If you want schools to open, if you want to get some control of the pandemic, the key is the we. You must do what you can. You have to think about you and your family, think about your community, and push your local leaders. I frame it this way because help is not coming from on high. Proof? There's no plan for better testing. I hear you all over this country saying you can't get results fast enough. I know. There's no plan for it to get better. There's no plan to help us reopen schools. And there is a reason for this inaction, and it has a name: Trump. Last week, he said it's going to get worse before it gets better. Now he says this.
I really do believe a lot of the governors should be opening up states that they're not opening, and we'll see what happens with them.
You know it's going to get better. You're not helping them to reopen. They're asking you for help, and then you say, but they really should be reopening. We are seeing what's happening. Death, too much of it. Cases, too many, too fast, too many places. In fact, there's a word for it. It comes from the Greek. Pan, meaning everyone. Demos, people. Pandemic, as in affecting all people. That's what we're seeing happening. That's what Trump knows is happening. The White House can't contain the virus within its own walls. Major League Baseball can't keep players from catching COVID instead of balls. How can this president and his CDC still argue it's safe enough to reopen schools in the fall with no plan? There is no irony in the fact that Trump's national security advisor now has COVID, Robert O'Brien. Listen, I wish Mr. O'Brien well. I hope he is asymptomatic. And if his daughter has COVID also, as is being reported, I wish her well. And I hope the rest of the family is spared, and anyone that he was around, especially the president. O'Brien was briefly in the White House last week after returning home from a business trip to Europe. Several pictures show him neither practicing social distancing nor wearing a mask. Think about it. The guy tasked by Trump with keeping our country secure isn't taking safety precautions and gets hit with what is arguably one of the biggest threats to our security right now. Trump said today he trusts all Americans to do the right things. His own national security advisor didn't. And many others aren't because of what he was selling them just before last week. The person you must question trusting on this is Trump. You must be outraged by the inaction. You must call on him to tell the experts around him, make a plan to increase our testing efficiency. Do it smarter. Get us results faster. 7-10 days doesn't help anybody. Have them make a plan to help states open schools. That's your damn job. You're getting killed in the polls in large part because you're not taking charge in a pandemic. Again, a virus affecting all people. More proof that all will suffer if we don't do the right things. Now, the newly kicked off baseball season, a source of just a flickering moment of joy for all of us. It could be in jeopardy less than a week after it began. ESPN says 11 Marlin players, 2 coaches, just tested positive, forcing the team to postpone tonight's home opener and tomorrow's game. The Phillies-Yankees game also postponed. The MLB is now conducting additional testing. This is the manager of the Washington Nationals today, and he has a heart condition.
I'm going to be honest with you, I'm scared. I really am. My level of concern went from about an 8 to a 12.
The Major League had a plan before putting players on the field. Again, there's no guarantee here. There's major money in baseball. All that planning, all that money, these great athletes, and yet we're supposed to say, yeah, the president's right. We should just open schools. States should just open them. How are they going to keep them open? Oh, I'll tell you what's great incentive. And if you underfunded schools don't open, the president's threat to make you do it is to withhold funding that goes to the neediest of you, in large part for feeding them. Seriously? Look at the reality. Players get tested all the time, okay? Trump's own testing, these players in baseball, they get tested a lot. Trump's own testing czar says testing's not where it needs to be. And that is a gross understatement, right? He's got to be careful what he says, otherwise he'll lose his job. So just look at the reality. You only control what you do for your family, what you can influence in your own community, and what you can demand from local leaders. I'm telling you, if you're waiting for Trump to use the federal government with all its power and influence, don't, because it's not happening. Let's bring in someone who can give us a giant dose of reality because we need it. Dr. William Schaffner. Look, I don't know about you. I'm a big baseball fan. I'm an even bigger football fan. And I knew this was going to happen, Doc. You get people in any proximity, the pandemic is going to manifest itself. Are you surprised by any of this?
Chris, I'm surprised that the Yankees game was canceled tonight, but it was canceled for good reason. Obviously, COVID got into the opposition. And anytime people gather together in any kind of circumstance, whether it's a baseball circumstance or a religious circumstance, for example, or a neighborhood barbecue, statistically speaking, COVID is attending that event with someone stealthily because they have no symptoms, but the COVID virus is spreading. And that's the sort of circumstance we're in today. The virus is still ahead of us over most of the United States. We're still chasing afterwards. And opening up quickly, that's cart before the horse. You know, if we could get control of this virus, and then we could open up carefully, and that would assure the restoration of our economic life. But this COVID virus has got to be dealt with first because it's not going away.
So the testing piece, I'm sure you're hearing this. More and more, even if people have access to tests, one, some of these tests, especially the faster the turnaround, the less accurate. And they're getting tested multiple times because they're like positive, negative. And the better the testing, the longer the time. So people are saying it's taken me 5 days, 7 days, 10 days, more than 10 days. Are you hearing that as well? And how problematic is that?
Oh, well, it's hugely problematic. And of course, I'm hearing it because it's true in many, many places across the country. Some laboratories are having difficulty with their reagents, so they're having to slow down. Other laboratories are so swamped with tests that they can't turn them around in time. And that's why you have this long waiting period before the test comes back. And what use is the test then?
Right.
So, yeah, this is a problem across the country.
Imagine that in the school context. So look, I've made no, bones about it. I want my kids to go back to school. It is very hard for us having them home. And I know for a lot of families, it's way harder for them because they're not blessed with the same means that I have. But I got to tell you, Doc, just on testing alone, God forbid a kid in a class gets it. You know they're going to. Now you have to test that kid. How long does it take to get the result back? So you go to a hybrid method. Few days in class, few days at home. To me, that's like the worst of both worlds. Now it screws up your work life because you have to be home sometimes, so you can't be on regular hours, and the kid's getting exposed in the classroom. I don't even know how they get to school. What does the bus driver do, Doc? And it seems to me that the solutions here have to be about public spaces and finding more staff and more spaces, but I hear nobody talking about it. What's your take on schools?
My take on schools is the countries that have done it well, of course, have controlled the spread of the virus first in the community, right? They did that first. Then they opened their schools. We're in the midst of all this brouhaha, and we're trying to open up our schools. Our schools are going to try to do the very best they can. They're trying all sorts of different things, and we all hope for the best, prepare for the worst, and worry a lot because we can't predict. Even we medical types can't predict exactly what's going to happen. So we'll be in a responsive mode, trying to change course kind of in midstream, adjusting to local events as they occur. And gee, there's no wonder that parents are anxious on both sides.
Yeah.
As you say, would like their children to go to school for lots of good reasons, but at the same time, they're cautious and indeed many times afraid.
And you know what we're going to see? More inequality, because communities where you see the virus being better controlled are going to wind up being more affluent communities. And their kids are going to get in school faster and more school. And now the kids that are in harder hit areas, and I'm telling you, they're going to correspond with poverty, are not going to be in school as much. They're not going to be as educated. And they're already at an imbalance. I just don't understand why the federal government doesn't step up, Doc, and make testing more of a priority, use all the assets of this economy to get the processing better, use its assets to help these schools. We're staying on them. As we get more information, I will always look to you to help us process it. Dr. William Schaffner, be well, and thank you, Doc.